without the cameramen. Okay? And the directors cannot work without the managers cannot work without the clerks. That's what is going on, and we need to fix this. I have a few recommendations at the end.
That's exactly where I was going to. You can tell them, look, fix it, work together. But it's not as simple as that. What has to be done to make them begin to work together like
right. First of all, we need to admit that there's an issue here. Okay? So, and let me go back a little bit and say, you know what? You guys are miracle workers. You are wonderful people. Doctors, you're great. Nurses, you're great. Midwives, you're great. Pharmacists, you're great. You've done a whole lot. Considering the low resource base you're coming from, what you achieve here is simply miracle. If I had the time, I would sing my sister Sinach song for you. You know, you're a way maker, you light in the darkness, you are just miracle worker. But you need to be a promise keeper. For you to be, you need to approach with generosity. To whom much is given, much is expected. Doctors need to accept the others, bring them together. By bringing them together, you're not dropping yourself. I do not drop myself. I'm OB anesthesia chief, or I was, before I handed over. When I go into the labor ward, the student midwife calls me by my first name, Sonny. And she makes coffee for me. Sometimes I make coffee for her. If she's struggling with IV, she calls me straight away. Life goes on.
Do you listen to her recommendations? Does she have recommendations for you?
Of course, we work
Suggestions?
Together. Yes, she does. And and it's easy for her to tell me, oh, Sonny, no, we're not going to do that just now. She's not afraid, even though she's...
Is it the place of somebody like her to be able to say that to you?
Well, it depends on the protocol you're running. There's a protocol. She knows the protocol. So, for instance, if I decide to do something out of place, I hope not. I can't remember an example. She will be empowered. She's empowered by the protocols, by the practice in the place to tell me, Sonny, we're not doing that.
Because I've heard a few pharmacists say, you know, look at the prescription and say, well, how could the doctor prescribe this? He shouldn't prescribe this. And he goes to the doctor and says, you know, for the kind of patient we have, this is not a very good prescription. We need to lower it, or we need to change the drug, and there's a whole lot of trouble.
Right. Okay. The answer to that, it shouldn't be at the level of the pharmacist and the doctor. It should be at a level of institutions. Okay. There are issues here. We quote the British standards, American standards. We should be able to quote the Nigerian standard. That is part of the job we're trying to do at the Patient Safety Skills Training Institute at Igbinedion University. Prof. Jacob Unigbe is leading that program, and the Vice Chancellor is very keen for us to use that hub to reach out to the rest of the country. And just yesterday, I met with the President of the Society of Gynecologists and Obstetricians of Nigeria. He was very pleased about it. The president of the West African College of Surgeons, Professor David King, also very keen about that.
So is this how you propose to go about it? You will be visiting major institutions to teach them about patient safety protocol?
Right. That is one of the ways. That is train the trainers, okay? Empowering them with tools like the maternal early warning course, which I'm going around the country to teach early warning course. But also, we want to empower the public. Okay, empowering the public on how they need to approach and become active partners in the process of healthcare, not passive anymore.
Okay, let's even talk about the patient himself.
Okay.
How does the patient engage in this patient safety conversation?
Excellent question. Thank you. Right. Let me just give an example, because it's very easy to point fingers. It's very easy to criticize others. You have all sorts of things, and people blaming the president, blaming politicians, blaming doctors, and just blame everybody, think it's been sorted. No, it's not been sorted because you're blaming people. Let me take an example. Mrs. X died of postpartum hemorrhage. What is postpartum hemorrhage? She lost so much blood, she died. But the reason why she died was not really because she lost so much blood. It was because the structures and the systems and the governance process were not there. Why? The doctors were there this time. Okay. The midwives were there this time. You, the mother of that woman. You, the village head where that woman comes from. You, the church member of that woman. you that knows this woman, you refuse to donate blood. In England, does the Queen
You're
give
making
her
it a
blood?
community-wide thing now.
Does the Queen give the blood to patient? No. Even if President Buhari bleeds all his blood and the blood of everybody knows, it can still not save. So except you start, this is not going to be fixed. President Buhari cannot solve it all. We got to start from our homes, from our families, from our communities, and then, if everyone takes his own, then it will get better.
Okay. Apart from blood donation, is there anything else? Because this is really getting good.
Of course. Come up, Say something good sometime when something happens. Don't just go to the internet and just whinge about, Nigerian nurses. Talk everything negative about Nigerian doctors. I've seen too many of it.
There have been, by people's reports, a lot of negative things, at least about nurses, how they treat people.
But at least there are some good things that have been done. Say something good about somebody. When I go to people, I thank them for what they've done. And for that reason, God has blessed me with so much access. There's hardly any place I've knocked on that hasn't opened for me because I learned to say thank you for what you've done rather than insulting them. So please encourage them. Be a blood donor. Encourage your family to donate blood. Support your hospital. This is Christmas time coming now. Okay, harvest season. Your local hospital, adopt a hospital. Let the mosque and the churches adopt their local hospital. So when there's fundraising, you give money. Like if you're a big church, you can say, I am going to sort out surgical equipment, like pulse oximeter. I would buy 10 for this hospital during this Christmas, and just take delivery of it.
So in other words, you're saying keep the morale of the health sector boosted by the little you give, and if everybody does a little bit of something,
yes,
then it's fine. We're going to take a break. Let's take a really short break and stay with us. We're coming in right after.